Imagine being a young woman, enjoying life, and suddenly facing a devastating stroke before the age of 50. Unfortunately, this is a harsh reality for many women who have experienced complications during pregnancy. Recent research conducted by Radboud University Medical Center has revealed a shocking truth. Women who have had complications such as preeclampsia, preterm birth, gestational diabetes, miscarriage, or stillbirth are at a higher risk of ischemic stroke before reaching 50. But here's where it gets even more alarming. This study suggests that these pregnancy complications can serve as an early warning sign for potential stroke risks, and it's crucial that doctors are aware of this medical history to provide preventive care earlier. The study examined over 1,000 women aged 18 to 49 and found that more than half of the women who had an ischemic stroke had experienced at least one complication during pregnancy, compared to only 1/3 of the women who had not experienced a stroke. Women who had experienced a stillbirth were found to be nearly 5 times more likely to suffer an ischemic stroke, while preeclampsia, preterm birth, and gestational diabetes were also clearly linked to an increased risk. These complications are often associated with vascular damage, such as atherosclerosis, which can lead to stroke. As neurologist Frank-Eric DeLee of Radboud UMC emphasizes, fortunately, the overall risk of stroke remains low, but we see that certain pregnancy problems can serve as an early warning. If doctors are aware of this medical history, they can start preventive care earlier. But what exactly causes these strokes? While the study doesn't determine the exact cause, several possible explanations exist. Pregnancy places a tremendous strain on the body, explains researcher and first author Esme Verberg. If complications arise, it may indicate vulnerable blood vessels. Another possible explanation is that pregnancy itself and the development of the placenta may lead to vascular abnormalities, resulting in atherosclerosis, which could later cause a stroke. The researchers advocate for physicians to actively inquire about previous pregnancies and start screening women with a history of preeclampsia for cardiovascular disease earlier rather than waiting until age 50. DeLue says, this study suggests we might need to start earlier as there is a clearly elevated risk of cardiovascular disease. This can be done easily, for example, by measuring blood pressure once a year. And this is the part most people miss. Recognizing the signs of a stroke is crucial. Stroke affects up to 1 in 5 people in some high-income countries, and nearly 1 in 2 in low-income countries, making it the second leading cause of death worldwide. In the Netherlands, approximately 30,000 people have an ischemic stroke, and over 50,000 people experience a transient ischemic attack annually. Signs that may indicate a stroke include a drooping mouth, slurred speech, and sudden weakness or paralysis of an arm. But here's the question. Are we doing enough to prevent strokes in young women? Should doctors be more proactive in screening for cardiovascular disease in women with a history of pregnancy complications? We'd love to hear your thoughts. Do you agree that we need to start screening earlier, or do you think there are other factors at play? Let us know in the comments. The study used data from 2 large databases, the Odyssey study, which followed young women who had suffered an ischemic stroke, and the PRIDE study, a national cohort study on the health of mothers and children during and after pregnancy. More information about the study can be found in the journal Neurology. So, let's spark a conversation. How can we work together to reduce the risk of stroke in young women and provide better preventive care?